All right. Good afternoon, everyone. My name is Crystal Garcia, and I'm the content coordinator here at the Texas Association Against Sexual Assault. Welcome to today's webinar, Safer Relationships and Sexual Assault Prevention, with the SAFE team. I'm going to let them introduce themselves in just a second, and we will move forward with today's session. Just a couple of housekeeping things. Today's content is being recorded for YouTube. We are offering continuing education with this session. However, we can only offer that to those who are joining us live for the webinar. If you're watching this via recording, unfortunately, we can't offer those continuing education credits to you. However, the information is valuable, and we hope you enjoy the content that you're going to learn from today. So if you have any questions during the session, I will be monitoring the chat, or you can follow up with me by email. Be on the lookout for a follow-up email about a week after today's session with your continuing education certificate, the recording, and all the other information that you need to know for this session. We are hosting 2 more sessions for our webinar series until the end of the year. So we will offer another one again in November and the final one in December. If you haven't already done so, please visit the TASA's website, and under our Contact Us page, there is a form to sign up for our email contact list, so you can join us for those great sessions too. So let's go ahead and get started. Looking forward to a really good session today. So I will go ahead and turn it over to SAFE and their staff, and y'all guys have a good time and learn some great stuff today.
Thank you so much, Crystal. We're very happy to be here. I'm excited to see in the chat that we've got folks from all over the state. We've got at least one person from Mesa, Arizona as well, and several of our staff from SAFE. So we are really excited to be here, and thank you so much for coming to our Safe Alliance webinar for TASA. We've got sort of the short title here up on the screen. The longer title is Sexuality, Safer Relationships and Assault Prevention for Young Adults with Intellectual and Developmental Disabilities, or IDD. My name is Annabelle Burleson. I'm the Associate Director, Disability Services here at the Safe Alliance. I have been affiliated with SAFE for over 35 years. First as a client in the shelter, and then went on to volunteer and a board member, and I am excited to be on the staff now. I am going to turn it over to Ronnie for her introduction.
Hello, everyone. My name is Ronnie Jepson. My pronouns are she, her, hers. I'm an educator and project coordinator here at the Safe Alliance. Very excited to be here today. So my background, I have a background in speech language pathology. I worked in the public schools before coming to SAFE, and I've worked with people with disabilities for at least 10 years now. So yeah, and I will go ahead and give it on to Sophie.
Hi, I'm Sophie Benitez, and I'm the Training and Education Specialist in Disability Services at SAFE. Prior to being the Training and Education Specialist in Disability Services, I was a consultant for SAFE and helped with giving input and creating some content in the My Rights, My Life curriculum. And I was also a student. I went through the My Rights, My Life curriculum at an adult transition service program that I attended in the Eanes ISD in Westlake. But I did not go to school in the Eanes School District. I went to school in Dripping Springs ISD in Dripping Springs, and I graduated from Dripping Springs High School in 2019. And since I was too advanced for the adult transition program at my high school in Dripping Springs, I went to the adult transition service program in the Eanes ISD since I was more of a good fit for their adult transition services program.
All right. So I know a lot of you already kind of put your information in the chat, what associations you're with, etc. We'll do just sort of like an informal share out, kind of how Crystal began the session with telling us how this, topic is important to her. We want to know, why is this topic important to you? What brought you here today? And what is your relationship with disability? Annabelle will be monitoring the chat, but feel free to just raise your hand or unmute yourself and talk. We're gonna keep it kind of loose.
The chat's pretty quiet.
Okay, I can start. So I used to be a disability counselor at the Houston Area Women's Center. I have family members with various disabilities, both visible and invisible, and I myself have some invisible disabilities.
Thank you for sharing that.
And here we've got someone who, as a mental health provider, I'm interested in gaining more knowledge, experience with providing services to individuals with disabilities.
Yeah.
Thanks for sharing.
Hi, I'm Melissa. I am Director over Primary Prevention with Family Ties in Waller, Texas. And I'm here because I just like to learn. And we deal with different types of students and children all the time. And so I just like to educate myself on it. So that's why I'm here.
Thank you.
We've got someone who wants to bring better inclusivity to their agency to support survivors to the best of their abilities.
Right.
And another advocate wants to learn how to better accommodate their clients who have disabilities and better recognize the barriers those folks might face. We're definitely covering that topic on barriers. Someone's 15-year-old son has CP and some significant speech delays. She worries about bullying at school because he doesn't speak like others, and she always strives to protect him. Okay.
Wow. You guys are sharing so much, and we appreciate everyone just jumping in the chat and telling us how you relate to this topic. Let's move on to the next slide, Annabelle. Feel free to keep typing in. This is another almost quiz-like question, but we are going to go over the actual answer later today. So compared to people without disabilities, how much more likely are people with IDD to experience sexual assault? So we will go a little bit more into this, of course, but do you think it's 50 times more likely? Do you think they're twice as likely? Much likely. Yes, Libby, that's correct. Okay, I see 70%. Yeah.
5 times. 5 times. High number, someone says.
Right. Yeah. So we'll kind of keep that question marinating in your brain, and we'll actually give you the answer later today. All right. Annabelle, do you want to talk a little bit about SAFE?
Sure. We want to first give you some information about SAFE and what we do at SAFE. Many of you may already be familiar with our agency. SAFE is a crisis center in Austin, Texas, that responds to domestic violence, child abuse, sexual assault, exploitation, and trafficking. SAFE stands for Stop Abuse for Everyone, and that is our mission. Our vision is a just and safe community free from violence. You'll see here on the slide that we have a 24-hour SAFE line for support and access to services. There are 3 ways to access our SAFE line. Folks can call the line, text the line, or chat from the internet to the line. Anyone who calls SAFE can be secure that someone who is friendly will answer and they will listen. Anyone can call, text, or chat with SAFE at any time, 24/7. We are here to support victims, survivors, and you. Yeah.
You're also asking if it's any state. I think, Annabelle, do you want to take that question?
Well, that is a very good question. I think anybody from any state can call us, but this is probably a good moment to just mention the National Domestic Violence Hotline. And the number for the national hotline is 1-800-799-SAFE 7233. And that definitely is open for anyone in the country. Let me see. I'll drop that in the chat. And okay, I think we missed a slide.
Yeah. Can you go backwards one?
There it goes.
There we go. So another thing to add to that is all of our services at SAFE are free, no cost to access anything. No matter your background, status, identity, you're welcome here. And we serve people of all ages, genders. You'll see at the top of the screen. Yeah, we're very inclusive here, and we want you to know you're not alone. At the end of our presentation today, we'll share that SAFE line information again, and you'll see it, more of our services.
All right, Disability Services is a 27-year-old program created in 1996. Specifically in the Disability Services program, we do a few different things. We provide trainings for people with disabilities on many topics, which it can include safety, healthy relationships, and safer sexuality. We also train and present to other disability organizations, victim service professionals like yourselves, criminal justice staff, family members, and other stakeholders in the community, like teachers and school personnel, direct service providers, advocacy groups, any of those types of folks. We're constantly working with other community partners to recognize and address the gaps in services for people with disabilities, because as we all know, there are many to confront and challenge. We are very excited to be here with you today to continue pursuing our mission of stopping abuse for everyone, including people with disabilities.
Right. So our learning objectives today, we'll start off by talking about how individuals with disabilities are at that disproportionately higher risk for sexual violence and exactly what is an intellectual disability. We'll talk about common indicators of sexual assault and abuse. I know a lot of you guys are already victim service providers, so it'll be, maybe a review, but we'll also talk a little bit more specifically about how to deal with people who present with IDD in those situations. We're gonna play a little true or false game around the myths and actualities behind dating, sex, and disability. We will review some concrete ways to teach skills related to healthy relationships and safer sex. And then lastly, we're going to go over a curriculum that we developed here at SAFE called My Rights, My Life. And we'll also have a list of resources that you can use in your pursuit to address the gaps in sex ed for those with IDD.
Today, we want to acknowledge that this is definitely a tough conversation. Like Ronnie said, we also want to acknowledge that some of this information about violence and assault is not new to some of you, but we want to be sure that we are not leaving out any information about your clients with disabilities. So talking about violence and assault can be difficult, and talking about sex can be awkward. We know that there are barriers to sexual assault prevention education to people with disabilities and their wraparound community, which includes parents, family, friends, peers, direct support staff, teachers, and more. These are people in the lives of people with disabilities daily. We want to also acknowledge how important self-care is during our presentation.
All right, well, we can't drive this point home more. I mean, self-care is so important, especially in these helping professions. So if at any point during the session you need to take care of yourself and get up, take a break, know that this is being recorded, so you can always come back and revisit. But yes, just keep taking care of yourself. Throughout the presentation, we're going to have Sophie start, but Annabelle will be monitoring the chat. So type away your questions.
Let's talk about why we're here, violence in the lives of people with disabilities. It is imperative that we understand ways to prevent this violence. And if it can't be prevented, we understand how to intervene in an effective way. We will start with a bird's eye view of disability and sexual assault and abuse, and then we'll talk specifically about intellectual and developmental disability. We know from a large national study with over 7,000 responses, more than 70% of people with disabilities said they had experienced abuse. From those who had experienced violence, most had experienced abuse on more than 20 occasions. This information tells us that people with disabilities are experiencing violence and abuse on a much larger scale than everyone else. However, only half of these incidences were reported to the authorities, and from those reported, only 10% of abusers were arrested. National Public Radio put together these statistics from unpublished federal crime data from the Justice Department. All individuals with disabilities experience increased sexual assault, but the rate is highest for people with intellectual and developmental disabilities. The rate of sexual assault is 7 times higher for people with intellectual disabilities than for people with no disabilities. The rate is 12 times higher if you look specifically at women with intellectual disabilities. Even men with intellectual disabilities experience sexual assault at higher rates than people with no disabilities do. Unfortunately, even these numbers are likely to be an underestimation. And the reason why is because there is always underreporting of sexual assault. The survey only looks at individuals aged 12 and older, and the survey does not include individuals living in institutions where the risk is higher or group homes. There is an estimated 373,000 individuals in group homes in the US. Another fact we know is that most perpetrators are people who are known to the victim or survivor, which tells us that most of those experiencing abuse or are most likely still in contact, rely on, or in a relationship with their abuser. The idea of stranger danger is not something we want to rely on heavily for the main theme of how to keep safe. While it is important to know how to be safe when around strangers, by and large, we see that most perpetrators are someone that the victims know and trust. For people with intellectual disability, research shows that 97 to 99% of abusers are known by the victim. Abusers can consist of family members or acquaintances. Also, disability-specific relationships can account for abuse. These include teachers, residential care staff, direct support staff, counselors, therapists, medical professionals, transportation providers, and personal care attendants. As the number of paid staff in a person's life goes up, so does the risk for abuse. There are some specific reasons why we see this phenomenon. One reason being that paid staff relationships is not the same as a meaningful relationship in the community. If someone is paid to be with you and care for you, it is not the same as someone who cares about you for who you are and is looking out for your well-being, unfortunately. We also know that if someone has a lot of paid staff to be with them, the more likely they are to be with those people in isolated environments. Abuse can occur anywhere in the community, of course, but it is much greater in closed institutional settings. Even in settings not completely isolated from the community, like group homes, we still see increased risk for abuse. Closed settings include state-supported living centers, state hospitals, larger group care facilities, nursing homes, and small group homes. Unfortunately, this means the system created to meet specialized care needs of those with intellectual disability contributes to the risk of sexual violence. Even in college dorms, because that is a form of a closed setting, between the ages of 18 and 23, the risk of sexual assault is highest, and this is common across the lifespan of all people.
Okay, so this is a power and control wheel, and they have specific ones depending on the population you're working with. So for immigrants, for LGBTQIA+ communities, but we want to make sure that we are aware of various power and control tactics, and it can provide critical insight for making decisions during crisis situations. So many of the spokes in this wheel are similar to the spokes in the original wheel. So for example, economic abuse is on the original wheel and this wheel, but for individuals with disabilities, it might be a partner or a parent or family care provider might control disability-related resources or income. Isolation is another tactic present on both wheels. An abusive partner might reduce or restrict the mobility of a person with a physical disability. Sometimes a partner who acts as a caretaker may refuse to help their partner get out of bed or into their chair, or they may hide their walker or cane. Withholding support or treatment can include the refusal to administer medications, giving too big or too small of a dose. They could also threaten to withdraw vital life support equipment. So these are just a few examples of how people can use their partner's disability to gain power and control. I know the text is a little bit small, so I'm not going to go over all of them, but I'll just read the names of the ones I didn't say. You have privilege, specifically around ableism, minimize, deny, and blame, emotional abuse, and coercion and threats.
So what exactly is an intellectual or developmental disability? Here is the definition of intellectual disability taken from the DSM-5. IDD affects people both in intellectual functioning and in adaptive functioning. In terms of intellectual ability, functioning is measured with test of intelligence. While a full-scale IQ test score is no longer required for diagnosis, standardized testing is used as part of diagnosing the condition, and clinical judgment is needed in interpreting the results of IQ tests by trained professionals. Regarding adaptive function, the following domains determine how well an individual copes with everyday life, activities of daily living, and self-care. The conceptual domain includes skills in language, reading, writing, math, reasoning, knowledge, and memory. The social domain refers to empathy, social judgment, interpersonal communication skills. The practical domain centers on self-management in areas such as personal care, job responsibilities, money management, recreation, and organizing school and work tasks. Lastly, intellectual disabilities manifest during a person's early development. There are many different causes of intellectual disability that can lead to overlap between different diagnoses. For example, it can be associated with a genetic syndrome, such as Down syndrome or Fragile X syndrome. Autism spectrum disorder and ADHD are often co-occurring with IDD. Intellectual disability can even develop following a variety of labor and delivery-related events or infections during pregnancy. All people are different, and that goes for people with IDD too. So a person may want to be referred to in different ways. The best way to know is by asking the person. You can also mirror the language someone is using. If you hear a person with autism refer to themselves as autistic, then it may be safe to assume this is the term they prefer. This is referred to as identity first language. Others may want to use person first language. Examples would be a person with autism or a person with an intellectual disability. And then some people do not identify as having a disability. We've worked with numerous people who did not identify as having a disability and preferred not to be referred to at all by their disability. The main takeaway is we need to always be mindful of the language we use so as to not cause further harm or trauma or shaming to people we are serving. If ever unsure of how to talk about someone's disability, just ask the person. If it is not relevant, refer to the person by their first and or last name instead of referring to the disability, and then treat the person with respect as you would anyone else. So we know that people with intellectual disabilities are impacted at different levels. But what are some of the real life implications? Processing and learning quickly or from experience, oftentimes people with IDD require increased wait time to process information. Thinking abstractly, concrete black and white thinking is often seen. Taking care of one's hygiene is an adaptive skill that often requires direct instruction. Communicating your wants and needs and understanding multi-step complex directions. These are receptive and expressive language difficulties often seen in IDD. And problem solving and planning referred back to those executive functioning, organizational skills that fall under the practical domain of adaptive functioning. These are just some common characteristics of IDDs. This list is not exhaustive. Okay, we will do another share out. Knowing now what we know about IDD, why do you think people with intellectual disabilities are at an increased risk of sexual assault? What are some of the implications behind some of the intellectual and adaptive impacts we just brought up? Please put your answers in the chat, or if you want to unmute and call out your answers, that is good too.
So we've got one here, vulnerability, less likely to be believed and less strong support.
Unfortunately, yeah.
Yeah. And then we've got someone agreeing with that previous statement. They may be nonverbal and unable to report. Potentially not knowing, oh my gosh, here we go. Harder for persons with IDD to recognize safe and unsafe people or to know a person's intention. They might be unaware that they were abused. It takes longer to process information.
Yeah. I think you guys got it.
Their need for the assistance of others can place them in a position to be taken advantage of or manipulated. I think that's a perfect segue for you, Ronnie.
Yeah, I mean, knowing what Sophie, said, some of the impacts of IDD, yes, you're at an increased risk for trauma. So I think someone had mentioned being isolated and experiencing loneliness. This will create risk for anyone. If you're feeling isolated from your community and you're alone, you're more likely to allow people into your life who have red flags. And you're more at risk for being around people who are not safe, definitely. Someone mentioned the communication. Yes, perpetrators are very skilled at looking for people who don't have a lot of power. So if there's a communication barrier, if someone's nonverbal, as someone said, they're vulnerable to abuse in this way. Okay, so this is one that's really big, learned compliance. The idea that from a young age, people with disabilities are taught to comply, to go along, taught to be happy all the time. You can't express anger. This is really problematic because when you teach compliance with anyone who they view as an authority figure, you're taking away their ability to advocate. You're also taking away an ability to report someone who might be an authority figure. So we want to end that learned compliance, that grooming, and we want to replace that with self-advocacy and self-determination. This goes into a lot of what Sophie had mentioned with the institutional settings, lack of privacy, physical boundaries, especially if you have a physical disability. You might need a lot of support around physical tasks, and when care is provided and it's not based on consent or someone's routinely accessing your body, you might just think, okay, this is the norm. This is how I've always lived my life. And it becomes normalized. So you're at a greater risk for abuse here. This is one that we are hoping to kind of combat in our program, lack of sexuality education. We often see, especially with the young children with IDD, physical affection is really encouraged. Oh yeah, come here, give me a hug, give me a kiss, come sit on my lap. And so they're encouraged to do that, unfortunately, past an age of it being appropriate. So that's something that we really want to keep in mind, is teaching people about like what is appropriate for your age. Yeah. And then harmful social messages. So we'll go a little bit more into this later, but you know, there are a lot of myths around disability and romance. There's also not a lot of representation that you see for healthy romantic relationships with people with disabilities and IDD, unfortunately. Yeah, if you feel like you never see yourself represented, it increases your experience of isolation and grief. So when someone comes along and says, yeah, I want to be your girlfriend, your boyfriend, your partner, whatever, your immediate reaction might be to say yes to somebody who might not be safe. And then threat of loss of independence. And this again goes back to those closed institutional settings. If you think about how, like, if you need to go to the doctor's office, for the most part, a lot of the times people can go somewhere and then leave. But if you're in a closed institutional setting, you're staying there. So you're, you know, not as independent as you might like to be. Okay, and we're going to go a little bit into the indicators of this. I know a lot of you are already familiar with this because of your member of TASA, so we won't go over everything super in depth, but again, we want to keep in mind the population we're talking about. So, you know, people with IDD, think about how these indicators are really magnified, right? So some of the behavioral indicators, you might see a sudden change in appetite, compulsive eating or dieting, you know, fear or withdrawal of certain people or places. If you see a sudden change in mood, you know, more fearful, more insecure, more withdrawn, that could be a behavioral indicator. And then also self-harming behaviors, cutting, burning yourself, hitting yourself. These are things that you want to look out for. And just some things that are not on here as well. If you notice like a person you're working with IDD all of a sudden has money, toys, gifts without reason, this is a red flag. If they write, draw, play around sexual images that is sudden, that's another indicator. Another thing is like if you notice that they have a new vocabulary for sex terms that you're like, where did this come from? That's something that you want to keep in mind. Talking about new older friends, someone that you've never heard of. And then in a school setting, if there's, you know, a sudden failing of classes, or if there's like a withdrawal of things that they like to do, that's another behavioral indicator. All right, so depression and anxiety, of course, we kind of mentioned this before. So if there are different emotions that you don't usually see. Suicidal thoughts or attempts, that's something to think about. Thinking of yourself or your body as repulsive, dirty, or bad. Yeah, after experiencing abuse, both youth and adults can view their body and as being dirty. Trauma can change the way you view yourself and have blame or guilt. And then again, we kind of talked about this a little bit, but if they are mentioning things that are kind of out of the ordinary, mentioning topics related to sex, aggression, or body parts, asking questions for a friend, refusing to talk about a secret shared with an adult, that is another indicator. And then, you know, a lot of these physical indicators, and actually, Annabelle, you could probably click through all of these. Yeah, physical indicators, you want to look out for some of the obvious ones like the blood, signs of trauma, unexplained pain or bleeding, unexplained infections or STIs, pain while using the restroom, wetting themselves. This is kind of an interesting one, difficulty swallowing, unrelated to a disability. And then, of course, if you see any bruising in a genital area, that is something to be aware of. All right. So again, we'll say that if you guys at any point have any questions, comments, just type them in the chat, or you can even like raise your hand and we'll get to you. So we're gonna keep moving forward. We're gonna talk about how to prevent abuse. Well, we have to know what abuse is, especially for people who present with IDD. We need to give them explicit education. It really helps in strengthening the knowledge of healthy relationships and then knowing what an unhealthy relationship is. All right, so self-determination is the process by which a person feels in control of their own life, and it's a protective factor. Greater self-determination increases ability to recognize and resist abuse. A 2005 study showed that when women with IDD participated in self-determination classes that focus on increasing refusal skills, they were better able to recognize and resist abuse, which I think is really interesting. Later on, we'll talk more about sex education, but that is also crucial to self-determination as well. And lastly, skill building and community participation, building meaningful relationships. That's one way to show people how to be safer in their community. All right. James Metters is a great example of building community. He is a self-advocate and activist. He speaks up for survivors with IDD. He's actually also on the President's Committee on Intellectual Disabilities. He is out of San Antonio. I'll leave this quote up for y'all to read. I won't read the whole thing. So again, this quote just demonstrates the importance of meaningful relationships in the community. All right. What do you think, Annabelle? Should we show the video?
Sure. So we're gonna switch sharing. I'm gonna stop sharing my screen.
And then I'm going to talk out loud while I do this so I can share my screen. All right. If for some reason y'all cannot see this, please holler. So this video, Sophie had mentioned the NPR article that came out in 2018. PBS NewsHour had a follow-up series about it. This video is only 3 minutes, but it is another example of self-determination. So it's a self-defense class for people with disabilities to fight abuse.
And now to our NewsHour shares. We've talked a lot lately about sexual harassment and assault. Last month, we reported on a group getting little attention, people with disabilities, and how they are victims of sexual abuse. From PBS station WGBH, Tina Martin shows us how a Boston area program is looking to change that.
I'm ready. We're ready. Let me go.
Christine Leary is learning how to gouge someone in the eye and run.
I don't want anybody to hurt me.
Because you don't want anybody to hurt you.
No.
This is a self-defense class with a little bit of a twist. It's specially designed for people like Leary, who has Down syndrome.
It's kind of fun.
It's a fun class.
Yeah. Should I go? That's a lot of money.
The Impact Ability Training Program is part of the nonprofit Impact Boston. The goal is to empower people with disabilities and teach them abuse prevention and safety skills.
No, I'm not for sale.
Meg Stone is the program's director.
Every national, state, or local study that has looked at sexual abuse of people with disabilities has found that people with disabilities, but particularly intellectual disabilities, are at significantly higher risk of experiencing sexual abuse.
At least 7 times more likely, according to unpublished data from the Justice Department, which was recently obtained by NPR. Stone says that's because they are more vulnerable.
They are too often taught to comply with the wishes of people without disabilities. You can run your disability service program much more efficiently if everyone eats the same breakfast and gets dressed in the way that you want them to and gets on the same van. But what that does is that it sends people with intellectual disabilities the message that their wants and their needs and their choices don't matter.
Please don't touch me. Oh, geez, I'm sorry. I think it's fine. No, it's not you. It says that I don't like to be touched by it's my body.
Mandy Doyle is one of the instructors at Impact Ability and says these classes take every individual into consideration.
Ways that people communicate differently, ways that their physical body might be different. So how can they access self-defense skills in a way that will work for them?
And the scenarios they play out are very real.
When we do the role play scenarios, another instructor plays the characters, the perpetrator, and I stand right next to them and help them figure out what they're going to say, what they're going to do with their body.
Christine Leary felt pretty good at the end of class and says the most important part of preventing abuse is this.
Tell someone who trusts.
It's just one of the many lessons the Impact Ability team hopes Leary and the rest of the class never have to use. In addition to the Boston area, Impact Ability runs programs in Chicago, Santa Fe, and New York, and has plans to expand to Columbus, Ohio in 2019. For the PBS NewsHour, I'm Tina Martin in Randolph, Massachusetts.
All right. Sophie, what did you think of that video?
It's a really good video.
Yeah, I thought it was really powerful. In our classes, we don't teach self-defense, but we do a lot of self-determination in our My Rights, My Life classes that we'll talk about later on. Yeah, I thought that was a very powerful video, to actually practice saying no and to practice doing that is, again, very powerful. So we'll continue on with this section, again, self-advocacy skills, communicating yes or no, whether that's a verbal or a nonverbal. It's crucial for safety and it's a learned skill. We know, unfortunately, that often children and adults with IDD are, again, taught to comply and say yes to all authority figures. So this is called compliance training. Sometimes this compliance training is so severe that individuals feel that they're not allowed to express those challenging emotions. You're angry that someone is in your personal bubble, but you're not allowed to say that. So it's the opposite of self-advocacy, like you said. If an individual does not use verbal communication, we need to establish how that person consents and refuses and respond accordingly and support them in building those skills. So whether that's using a communication device or any kind of gestures or a sign, that is something that we as providers need to do. All right, creating a culture of consent. We'll show you guys later an example of our consent check-in tool on the My Rights, My Life curriculum. Within your own practices as victim service providers, you can create a culture of consent that is modeled from the top down. Regardless of who you're working with, if you model consent in your everyday practices, it will be an instance of incidental teaching for everyone. So that doesn't necessarily mean calling out, look, I'm asking for consent. you're really just showing that, oh, okay, hey friend, can I borrow your stapler? Oh no, you're using it? Okay. And that's a moment of modeling that is really powerful for everyone, regardless of who you're working with. We want to remember consent is an ongoing process. It's not just a one-time thing, a few times thing, or a sometimes thing. It's demonstrated all the time. And these are things that we just have to kind of keep in mind. You know, change does not happen overnight, unfortunately. It takes repetition and time. You know, we've heard that idea that it takes 3 weeks to build a habit, or to break a habit, I'm sorry. But it can take people a little over 2 months, apparently, to get their new habit to stick. So we have to be really consistent and intentional. Again, I'll say modeling. You know, daily modeling from authority figures is really important, especially if you are in power, as most of us might be, as victim service providers. We're not saying don't, you know, give hugs to the people that you care about, but we invite you to think about how you use that language and the steps around obtaining or giving consent. And lastly, prevention work is everyone's job. It's important to know that you have a role to play in building, modeling, and respecting boundaries. All right, so this slide is from Planned Parenthood. You'll see that there's a lot of tips on here. We're going to shift to talk a little bit more specifically about talking about sex and dating. It's important to acknowledge unscientific terminology, but also important and good to share scientifically correct words. So we'll talk a little bit more about how we do that in the My Rights, My Life curriculum, but also if you're talking to someone who's disclosing abuse to you, you want to make sure that you're getting the actual anatomical terms. So they have to learn that stuff, right? It's good to avoid negativity and not make dating and sex sound scary. You want to make sure that you're staying positive. It's, you know, we want to create a sex positive environment as much as possible. And acknowledging that talking about sex is awkward. It's awkward to talk about it in front of 100 people right now. You know, you want to use accurate pictures, plain language, especially when you're speaking to people who have intellectual disabilities. People learn a lot of different ways, regardless of if you have a intellectual disability. You know, you learn best by listening. People are kinesthetic learners, so just keep that in mind. And then remember to keep your answers as brief and don't make the language as confusing as possible. Even though it's a very complex, thorny issue, we want to be as completely honest and say the truth so there's no misinformation. Yeah, if you don't know the answer to something, say you don't know the answer. You guys can look up the answer together. This kind of goes without saying, but you know, if you're looking up something online with the person you're working with, you know, just be mindful that not everything on the internet is correct. So just have reliable sources. And then at SAFE, you know, this is something that we really value. We want to include all identities. We want to reframe the language that we use to be gender neutral. So, for example, from our My Rights, My Life curriculum, we try as much as possible to talk about relationships by saying romantic partner, or we might say your boyfriend and your boyfriend, like boyfriend and boyfriend, or girlfriend and girlfriend. Because there are all different types of relationships. And then visual inclusion, put up pride flags, and also make sure that you are not gatekeeping any resources for anyone who is LGBTQIA+. All right. So accessibility ideas, like we said, people learn in different ways, right? Having pictures, physical objects. Remember that all of these are accessible for everyone and it could be beneficial for everybody. Repetition and repeating the information is helpful for everyone as well. And then playing games, I think especially for folks with IDD, Many times you have to get buy-in on a non-preferred topic. And honestly, talking about sex with someone who's in an authority role doesn't necessarily sound like fun. So you want to make that as engaging and gamified as possible if it's something that's interesting to your client. And then remember that we want to make sure that our content is culturally relevant. You know, it makes people more engaged. Using emojis, I love to use GIFs, asking about social media, that kind of stuff is another way to get that buy-in. So these are some just examples of what we use in our My Rights, My Life curriculum. I'm not going to talk about each one super in depth. Yeah, so there are lots of ways to talk about bodies, boundaries, and sex. We'll actually show you an example of the cool, not cool game later on. So we can actually go through this, Annabelle. All right, so take it away.
All right, so now we're going to switch gears and talk about general dating and relationships when it comes to disability. Based on what we've learned, explicit teaching of a skill can often be beneficial to people with IDD. Teaching about healthy relationships and sex education is just one of the protective factors against sexual abuse and assault. To get our brains ready for this, let's first talk about debunking ideas society may have ingrained in us. We will do a true or false activity around the myths behind disability and romance. We're going to read some statements on the next slides. You can just type 1 or 2 in the chat. Annabelle and I will monitor what numbers people put in the chat. If people do not talk about love and sex, then they are not sexual. Is that 1 true or 2 false?
We're getting lots of 2s there, Sophie.
Correct. This statement is false. We know that people with disabilities express their sexuality in diverse ways, just like people without disabilities. How many of you ever told your parent that you were having sexual feelings? Right, just because they aren't speaking about it with their parents doesn't mean it's not happening. Research shows that asexuality is not more common for people with IDD. However, it may be more noticeable sometimes. This myth often stems from treating adults with IDD like children. Only a small percentage of people with or without disabilities identify as asexual. Learning about sex and dating increases the likelihood of safer behaviors around sex. Is that 1 true or 2 false?
I'm seeing lots of 1s pop into the chat here. For true.
Yes, this statement is true. We know that too often people do not put their students or children in sex education because they believe this misconception about if they learn about sex and dating, they will have sex. Actually, comprehensive sex education has been shown to increase safer behavior related to sexuality by causing youth and young adults to delay sexual activity, reducing frequency of sexual intercourse, reducing number of sex partners, and increasing condom use. Boys and girls should be separated when they learn about bodies and sex. Is that 1 true or 2 false?
And we've got the 2s for false.
Correct. This statement is false. Research on sex education shows this is not the best practice for many reasons. The first reason being that it is an unsafe choice to present to students, children and young adults who are non-binary and transgender. The second reason is because it reinforces the idea that sex shouldn't be discussed in mixed company. We don't want to reinforce that this is a shameful, wrong, or not a topic to talk about. We want folks to be prepared to have conversations about their sexual limits, STIs, condom use, and protections with any gender, because we are not assuming who their sexual partner is going to be. It also gives the idea that students of different genders are receiving different messages. An interesting fact is when students were asked what makes them the most comfortable when receiving sex education, it was not about being with only people of the same gender. It was about how comfortable the facilitator was with the material. If the facilitator is very stiff and uncomfortable, so will the conversation. If the facilitator can recognize the awkwardness and talk through it and help people feel comfortable in these conversations, students are much more engaged and open to the sex education. A survey shows 65% of students actually prefer mixed gender instruction. Even if parents and teachers don't think someone is ready to date or have sex, people with IDD still need sex ed. Is that true or false?
There's the ones for true.
You all got it right. This statement is true. A lot of the time, people may think their child's family member or young adult is nowhere near ready for this type of information, but we know that all people deserve and should have the right to information about their body, sexuality, and sexual desires. Information needs to be provided based on an individual's biological age so that it parallels their development, not based on their support needs or based on their disability. Of course, how information is presented should be adjusted or adapted to functional needs. Accommodations should be made so that the individual can access the information. But information should not be based on where that teacher or parent thinks that person is. Only straight people with disabilities are sexual. Is that one true or two false?
And we're getting twos in the chat and even 1, 2 with laugh out loud.
Of course, this is not true. People with disabilities are sexual and express their sexuality in ways that are as diverse as everyone else. The percentage of gay and lesbian orientation occurs at about the same rate in people with and without disabilities. Too often, a lot of people have power over another individual's expression of sexuality. For people with disabilities, when they may not have as much power or access to information about different sexual orientations or gender identities, it can be really hard for them to express who they really are. We also see that for transgender and gender diverse individuals, they are 3 to 6 times more likely to have autism. This is the last question. People are safer when they don't date. Is that true or false?
The twos are coming up saying that that's false.
Yes, this is not true. Some, if not most of us, were raised in the era of stranger danger. Yet, as we talked about, we know that the most likely perpetrator of abuse is someone the person knows and trusts. The fact is, people without disabilities would not be safer if they don't date. Regardless of if you date someone or not, you still need to be aware of your safety in the community. However, what does increase safety are meaningful relationships within the community. We want people to be out forming meaningful, healthy relationships. Preventing someone from expressing their sexuality will not prevent sexual desires, etc. They'll just find other ways to express it and in turn may hide what they're doing. We as service providers, friends, family members, cannot find ways to support individuals if we do not know what they are going through. We will discuss our curriculum that we have been working on for the last few years, My Rights, My Life, an inclusive and accessible curriculum all about healthy relationships. The curriculum consists of 30 classes divided over 4 units. It is designed for young adults who present with IDD. The curriculum was completed in early spring of 2023. It is available and free to everyone. Anyone can access the curriculum on the safeaustin.org website, as well the link that you see here. Each of the classes have a downloadable facilitator's guide and a PowerPoint with instructions in the note sections of these slides for the facilitators. And the curriculum is available in Spanish and English. My Rights, My Life was piloted in transition age 18+ programs in the Austin area school districts. As we will mention later, we are in the process of getting this word out across other settings, including the ones listed at the bottom of the slide. Oftentimes, speech and language skills can be barriers for those with IDD when accessing a general education curriculum, let alone sex ed. For many folks, it is important to have multimodal access around sexual vocabulary, hearing it, seeing it, saying it. In our curriculum, every lesson comes with an important words vocabulary list that has easy to use definitions and visuals. Every lesson is equipped also with a core language board for people with complex communication needs. This is a big part of the curriculum, and this is called our Healthy Relationship Toolbox. In it, there are these tools to help our guide through thinking about relationships. Let's take a closer look into what each of these tools are and how we can use them in all different types of relationships in our lives. In the Healthy Relationships Toolbox, there is the I Statements tool to tell people how you feel, what you want, and what you need. The second tool is a relationship map tool, which helps you to think about how much you know people, who you can trust, and helps you understand how to interact with people depending on if they're in your green circle, yellow circle, or red circle. There is also the no tool, which you use to say no to the things that make you feel comfortable. Specifically, the no tool shows students that it's always okay to say no to anyone or anything that is crossing your boundaries. Lastly is the consent check-in tool. Consent check-ins are ongoing, and it's not just a one-time or a few times thing. As we talked about earlier in the presentation, it is an always thing. The Healthy Relationships Toolbox is the basis of many of our lessons. As we just saw, we have a consent check-in tool, but we also go more in depth class by class to have more skill building. This is an example from our Unit 1 class all about consent. The curriculum has lots of activities to keep students engaged, like we have talked about, these topics can be tough and we want to find ways to navigate and explore them. We showed a bit of this earlier, but this is an easy game we play in our classes to teach boundaries. It's called the Cool or Not Cool game. The students go through scenarios and decide if the actions kept or violated a boundary. You can adapt this in different ways. If you think this is cool, go to the left side of the room. If you think this is not cool, go to the right side of the room. You can give students handheld paddle signs or note cards that say cool or not cool, anything to increase the interaction. What I learned in the My Rights, My Life classes and my experience are, I learned about catfishing, sexting, and cyberbullying in one of the online safety classes. I also learned about how to make social media accounts private for more safety online. And I also learned about really not knowing someone if you met them online and what information would not be safe to share with someone I met online, and also how to safely meet the person I met online, bringing a trusted adult with me and meeting at a public place, not at your house, and not accepting the invitation to go to their house until you've seen them in person for a long time with a trusted adult and got to know them really well. And I also learned about STIs and protection and asexuality, and I learned more about sex and pregnancy. I learned about the relationship map, which helped me with thinking about relationships and how much I know people, and depending on how much I know the person and the type of relationship I have with that person, choosing what to share with them. And I learned about what you need to have healthy relationships, the no tool, saying no, and always being able to say no when something is not okay with me, consent and ongoing consent check-ins, always asking before I touch a person, borrow something from them, share their story, take a picture of them, post something online about them, the I statements, telling people what you want, what you need, and how you feel, and boundaries, what you are okay with and what you are not okay with. People have different personal limits. I learned about self-advocacy, speaking and stating my wants and needs, and I practiced self-advocacy more in my daily life with my family and at my job. And I also learned about sexual assault and sexual harassment, and I learned about unhealthy relationship behavior and red flags, and I learned about what abuse looks like. And I learned about gender stereotypes and gender identities and LGBTQIA+.
Thank you, Sophie. Yeah, thank you for sharing that, Sophie. So as we had mentioned earlier, we're in the process of expanding beyond the special education 18+ programs and getting into adult day programs across Central Texas. We're also figuring out our next steps on how to adapt this curriculum for late middle school, high school age students. We've heard from a lot of educators that this is the sort of information that's vital for, their high school age kids as well. So in the coming years, that's a big task of ours. You might hear from us again, hopefully. In the meantime, so we're continuing to provide support to community members who are looking to use this for adults 18 and plus. And as we mentioned, the curriculum is free of charge. We're available to assist you. We could do wraparound trainings with your staff and families. We could do train the trainer with you guys. We can present the class ourselves. We'll also provide technical assistance in case something is up with the curriculum. Yeah, if you end up using the curriculum or if you're interested, please just email us. We want to know who is using this curriculum and what settings and where are you? So please let us know. The next 3 slides are resources that we'll share with you guys. I know you guys already got notes about them, but they have just great videos, great information for y'all to look at. We use amaze.org a lot. So we can click through here. Yeah. And then let's do one more click, Annabelle. Sweet. Okay. I know we're coming up on time, so I'll go kind of quick-ish through this part. Trauma-informed responses and supports. Just to kind of wrap things up, we have reviewed a lot of information. So we talked about violence in the lives of people with disabilities. We talked about some of those misconceptions, how to spot indicators of violence. So now we're going to circle back around and talk about how do we respond in a trauma-informed way. And I want to, say again, a lot of you are familiar with this, maybe in just your work or just by having a family member with IDD, but I want you to really just think about these things when you're talking about someone with IDD. So we talked a little bit about those indirect disclosures, looking for those physical, mental, behavioral health indicators of trauma. Remember that survivors may not have the language or they might be too scared to disclose abuse. So those nonverbal and indirect disclosures are pretty common in this population, and it's important to recognize. You may also get information from family members or caregivers who comment on a change behavior. So just remember, it's a change in behavior without other explanation. So trauma-informed responses, this general information is applicable to any victim survivor. So number one is just to believe someone, believe the person and listen if they disclose sexual violence. Remind them that they're safe with you. I'm glad you're sharing this with me. I'm here for you. I'm sorry that happened to you. Trauma-informed responding also includes telling them it's not their fault. There can be a variety of emotions after abuse. All are normal. So you might see someone who's numb, someone who's laughing. These are all normal responses. But just let the person know that they are not alone and they can get help. Yeah, listen with care. Tell them, man, you've gone through so much. And I have a note here about, using the word survivor. I know you can kind of go interchangeably. Some people who have experienced abuse or assault identify as victims. Some identify as survivors. Some are thrivers. So some are a combination of 2 or 3. So it really varies by individual person. So, how Sophie was talking about earlier, using identity first, person first language, you just be mindful of using either survivor, victim, or thriver. Firmer person's strengths. I'll give you guys a few seconds to read some of the words you can use. Okay. You can tell me as much or as little as you'd like. What can I do to support you? What would you like to do next? Remember, don't be pushy. Remember that power and control wheel. Let the person have that self-determination to determine how much they want to disclose to you. And then we want to, let survivors set their own pace for healing. Ask them, what are you most worried about right now? What do you need right now? We mentioned this earlier, but remember, you're probably seen as an authority figure. So responding to a disclosure of abuse, you want to make sure that you are a supportive person in this healing journey. So remember, you don't also want to keep promises that you can't keep. So that's really important. You want to avoid that. So you don't want to say, this will never happen again, because you really can't control that. So be honest and keep your word. We're going to talk a little bit more about mandatory reporting a little bit later. But some things you can say to someone include, I'm here for you. You can share anything you'd like with me. And then remember to just take care of yourself as well. All right, so the next couple of slides are what to avoid. So the why questions, they can be very accusatory. You want to understand the situation as much as possible, but try to let the victim survivor lead the conversation. And typically your question will be answered. So try to avoid why questions and minimizing. This can be hard sometimes, trying to avoid speaking negatively about the person who hurt them. It's a very easy trap, but remember, especially for some folks with disabilities, these people are the ones who are in their lives. That's their main caretaker, the person who helped them get dressed. And then for yourself, try to avoid moments of self-disclosure. You want to connect with someone, let them know how you understand how you feel, how they feel. That's great, but be mindful to not shift the attention. All right, and the next few slides are all about establishing clear boundaries. So we'll talk, actually, if you skip to the next slide. Yeah, so let's talk a little bit about the mandatory reporting, because as many of you probably know, we are all mandatory reporters in the state of Texas. If there's a suspicion of abuse, neglect, or exploitation of people who are adults, who are elderly, or who have disabilities. So at the end, we're going to share the hotline. But for this slide's purpose, we want to think about how to mindfully communicate this to a person who is disclosing abuse. You know, when you hear the words mandated reporter, it's already pretty intimidating, and we don't want that person to feel a betrayal of trust. So it is really important to be upfront with what you need to report to DFPS. And then for those of us in the wraparound community, we need to rely on other professionals to help us in trauma-informed care. You know, whether that's seeking legal help or getting professional counseling. So make sure you cannot handle all of this on your own. If someone discloses abuse to you, it is a network. So right here, we'll go over some trauma-informed support for people with IDD, some tips for communication. Always presume competence. Do not talk about someone in front of them. You want to involve them in the conversation. So even if you're speaking to, you know, a caretaker or a trusted person, someone who knows them well, it's going to be a conversation with the person who's disclosing as well. Provide them dignity. Speak in your typical tone of voice. And then for asking questions, yeah, use both open-ended and yes/no questions. Just be mindful of not asking too many questions. So that's for anyone, any victim survivor, but especially for those with IDD, you want to give them some wait time to respond. These next few bullet points have to do with like that speech and language difficulties. So use concrete language. We know that non-literal language can sometimes be difficult. So use real anatomical terms. If you cannot understand someone, be honest about it. And at the very end, we talk a little bit about those sensory needs. So remember that eye contact may not be comfortable for a lot of people. They're not trying to be rude. So you just need to be mindful that like sometimes you don't want to look at someone while you're talking. If a person with IDD has sensory needs, like, you know, loud noises or lights can set them in a mood, that can be a trigger. So allow them opportunities for self-soothing. And then I want to make a note, we'll have a link to our All Kids Safe app, but we have more tips on how to do this. The app is more specific for like law enforcement and child protective services working with children with disabilities. But like if you go through the app, they have all kinds of tips for talking with people with different disabilities. So we'll have that link.
And yeah, we need to move on to wrapping up out of respect for people's time.
I know we got 4 minutes.
Yeah, really quick.
So we got, you know, the mandated reporters. We know that all citizens are required to report no matter what your job is. And then let's see. If you skip ahead, Annabelle, to the next one. Yeah. So this is the Texas Abuse Hotline. I'm sure many of you have this. And then if you go to the next one, we have our All Kids Safe app, some more information for you. And then we can close with a Brene Brown quote, because who doesn't love Brene Brown? I won't read it. You can look at it. But we thank you guys again for joining us today.
And SAFE would like to thank the Texas Council for Developmental Disabilities for their funding for this curriculum and our work here today. And we have the link to our evaluation. TASA also has an evaluation form for you to complete. It will pop up when this session ends. And there we are with our email addresses. Please feel free to reach out. And you are most welcome. Thank you for all the thank yous. We're glad that we could be here today, and certainly hope that you got something out of the presentation.
All right. Thank you again, everyone. This was such a great session. So much great content. I'm so grateful we have it and we can go back and we can look at the recording because there's a lot of great stuff to reference here and who we're working with young people, but also expanding our partnerships with stakeholders in our community. Sometimes we leave out the other service providers that are working with people with disabilities, and we think they'll come to us, and now we have a lot of great information to go out and make partnerships with them as well. So again, like I said at the beginning of the session was recorded, will be available on our TASA's YouTube page. If you're not following that, please do so. We have lots of great learning sessions on there. We will be sending a follow-up continuing education certificate for the people that completed the session today, and a link to access the recording. If you have any questions in the meantime, please feel free to reach out and get a hold of me. Again, we did email a handout, so if you did not get that, please follow up with us and make sure that you get a copy of all this great information. So I'm going to go ahead and end our recording for today, and please feel free to stick around, ask questions. But if that's everything, then we will see y'all next month for our next topic. Thanks, guys.
Thank you.